this is Carl. I'm a first year nursing student and I'll be assessing the abdomen for this video. So an assessment of the abdomen can provide diagnostic clues of the gastrointestinal and genitourinary pathologies. And it could also give insight regarding abnormalities among other organ systems. So the first thing that we need to do is to check for the patient's medical records to determine the scope of assessment needed so that I can prepare the necessary materials prior to meeting the client. So the first thing that I need is a measuring tape, stethoscope for auscultating abdominal sounds, a pen to mark. Now that I'm done preparing these materials, I'll be washing my hands before meeting the client. Hi, my name is Carl. I'm a student nurse, so may I have your full name, please?
My name is Strawberry Lois R. Cuenca.
When is your birthday?
June 21, 2003.
Okay, so how old are you?
18 years old.
Alright, so how do you want me to call you?
You can call me Red.
Okay, so Miss Red, I'll be with you for your abdomen assessment for today, and with that, I'll be needing you to remove your clothes so that I will be able to inspect, auscultate, percuss, and palpate in that same order. Will that be fine with you?
Yeah.
Okay, so do you have any questions or clarification before we start the assessment?
None so far.
Okay, so you don't have to worry at all. All this information that I'll be gathering today will be kept confidential. Okay, so are you feeling comfortable right now? Okay, so I'll be providing you with privacy by closing the curtains. Before I proceed with the assessment, I'll be interviewing the patient for a health history taking to gather subjective data that may reveal the patient's health concerns. Alright, so one last thing, I'll need you to void or urinate first to eliminate bladder distention that might interfere with the abdomen assessment. Alright, so I'll be waiting for you here. Okay, so Ms. Red, thank you for cooperating. I will assist you now to a supine position. This will allow your abdominal muscles to relax, and also I will drape your body. I will only leave the abdomen, which is the only part that I'll be assessing. Alright, so for the first part of our assessment, I will only be observing for your abdomen. So can I lift your shirt for now?
Sure.
Okay, so alright, so I can see that there are no visible vascularity that might indicate circulatory issues. You haven't had any stretch mark either. Your abdomen is free of scars, lesions, rashes as well. If there were, I will be noting for it in its location on your abdominal quadrants. Alright, so I'm going to inspect for your umbilicus for its color, contour, and location as well, if it's deviated. Alright, so your umbilical skin tones are equal to surrounding abdomen skin tones and is round, and also it is not deviated from the center. Alright, so for the next part of the assessment, I will be inspecting for your abdominal contour or the profile line from the rib margin to the pubic bone. Alright, so I want you to take a deep breath, then hold it in. This will make an enlarged liver or spleen more obvious. Alright, so abdomen is flat and has no evidence of enlarged liver or spleen. Alright, so now that you've emptied your bladder earlier, I will be measuring your abdominal girth or the circumference around your belly button. Alright, so I'll mark your belly button to make sure that it is measured in the same location for the next assessment. Okay? Alright, so I'll be inserting this measuring tape under. Okay. Alright, so it is 77 centimeters. I'll be documenting it. Alright, so I'll be moving towards your foot to check if your abdomen is symmetric. Alright, so abdomen is symmetric in a relaxed position. This time, can you raise your head for me? Alright, so no bulging as well. That might indicate herniation or diastasis. Movements caused by respiration is symmetric as well, and no peristaltic waves that are observed. Okay, so alright, so I'll be auscultating for your abdomen this time. So first, for bowel sounds, I will be needing my stethoscope to auscultate for it. And don't worry, I'll already checked the temperature and it is already warm enough. I'll just be cleaning this one. Okay. Alright, so I'll be lightly placing my diaphragm of my stethoscope to assess for high-pitched sounds. Alright, so on your abdomen's right lower quadrant, and then clockwise. Moving on to the right upper quadrant. Moving on to the left upper quadrant. And then lastly, the lower left quadrant. Alright, so I heard growling sounds in your stomach, and this is normal since our abdomen makes the gurgling sound at a rate of 5 to 30 per minute. Alright, so now I'll be switching to the bell of my stethoscope. So auscultate for low-pitched vascular sounds on the aorta. The next is for the renal artery. Next for the iliac artery. And then lastly for the femoral artery. Alright, so I haven't heard any brute sounds or murmurs, which is normal. Alright, so this time I'll be auscultating on your epigastric and umbilical regions for venous hum, which is not normally heard in those areas. So, okay, so venous hum might indicate hypertension. First for your epigastric, then your umbilical region. Alright, so I don't hear any whining noise or venous hum. Alright, so for the last part of auscultation, I'll check for friction rub over the spleen and the liver using the diaphragm of my stethoscope. Alright, so I'll be checking at the lower rib cage from left and right. Alright. Alright, so no friction rub is heard, that might indicate infection. Alright, so for the next part of the assessment, I'll be percussing your abdomen for resonant sound or timpani. Alright, I'll be starting from the right lower quadrant. Moving on to the upper quadrants. Alright, so the next part will be assessing the span or height of your liver. So I need to determine the lower and upper border first. Okay, so to determine the lower border, I will start at the right lower quadrant along the mid-clavicular line, and then I will be percussing upwards until there is a change from tympani to dullness. Alright? Okay, I'll start now. Alright, so I'll be marking it. This will be your lower border. Can I mark it now? Alright. Alright, so this time I want you to take a deep breath and then hold it in. Alright, so inhale, then hold it in. I'll be percussing downwards from the dullness earlier, lower border of dullness. Then I'll mark it. This is the descent of your liver. Alright, to determine the upper border, I will be percussing from the upper right chest along the mid-clavicular line, and I'll be starting from the right nipple area. Alright? Okay, so I'll be marking it now. This will be the upper border of your liver. I'll be repeating the percussion of the liver along, this time along the mid-sternal line or the center of your body. Alright? Okay. Then this will be the lower border of dullness of your liver. I'll be marking it. And then I'll start at the top for the upper border. Alright, so this will be the upper border of dullness of your liver. I'll be marking it. Alright, so now that we've determined the upper border and lower border of your liver, I'll be measuring it now. Alright, so I'll be percussing this time for your spleen. So for percussing the spleen, I'll start from the posterior to the left mid-axillary line at your side. So then downwards, I'll be moving downwards until I feel the change from long resonance to splenic dullness. Alright? Okay, so another method of percussing the spleen is to start from the anterior mid-axillary line Alright, so upon percussing your spleen, the observation indicates that there is no sign of enlarged spleen. Alright, so for the next part, I'm going to do a blunt percussion to assess for tenderness, starting with your liver. So I'll assess you to a sitting position. Alright. Okay, so I'm going to strike your lower rib cage with using my ulnar surface of my fist. Alright, so tell me if you feel any pain. Alright. Alright, so is there any pain? Alright, so no pain and no tenderness found on your liver. Alright, so I'll be doing the same thing at your back for blunt percussing your kidneys. So I'll strike using my right ulnar surface of my hand, and then just tell me if you feel any pain, alright? Okay. Is there any pain?
No.
Alright, so no pain and no tenderness found and elicited on your kidneys. Alright, so let me assist you to a supine position. I'll be draping your lower body. Alright, so this time, this will be the test for abdominal distension, bulging flanks, or ascites. So, I'll be percussing across your flanks until there is a change from dullness to tympany. I'll be marking that point as well. Alright, so for ascites, let me assist you to a side lying position. Okay. Now I'll be doing the same thing again. Okay, you can relax now. Alright, so there are no bulging flanks and ascites that might indicate liver damage. Alright, so for the last one, for percussion, I'll be performing fluid wave test. What I want you to do is to place the edges of your hand firmly down the midline of your abdomen, just like this. Alright? Okay, so do it. I'll be placing one of my hand at the side of your abdomen, and one will be for tapping your abdomen. I'll be tapping your abdominal wall. Alright, so there is no fluid wave that might indicate ascites. Alright, so now that you're in a supine position, I'll be performing light palpation to assess for tenderness and guarding. So I'll start from the right lower quadrant. I'll palpate for at least 1 centimeter deep. Then I'll be moving from one quadrant to another. Alright, so abdomen is non-tender and soft. There is no guarding as well. So I'll be performing deep palpations this time. So I'll be doing it deeper now. Just tell me if you feel any pain, alright? Okay, so this is to evaluate for subtle masses. And if I find any resistance, I might have to take note of it. Alright, so if I find any resistance, I might have to use bimanual deep palpations or using both of my hands to palpate deeper. But for this case, no severe tenderness or pain that may relate to trauma or enlarged organs. So I'll also be compressing to a depth of 1 centimeter for all quadrants to assess for masses. Alright. Alright, so there are no detected masses that I should be noting as well. So this time I'll be palpating for your umbilicus for swelling, bulges, or masses. Alright, so center is not too soft for potential herniation, and there are no hard nodules. Alright, so this time I'll be palpating for the aorta to assess the pulsations of abdominal aorta. Alright. Alright, so tenderness is mild with a moderately strong but regular pulses. Okay, so this time I'll be palpating for your liver to assess for consistency and tenderness that may indicate vascular engorgement or tumors, and I'll be placing my left hand at the back at the 11th and 12th ribs, and the other hand pointing towards your head. Alright, so I want you to inhale, and I'll be pushing my fingers upward and inward. Then relax. Relax. Alright, so the lower edge of your liver is felt and it is smooth and even. No tenderness also is found. Alright, so this time I'll be palpating, hooking. I'll be curling my fingers like a hook to assess for enlargement of the liver. So I want you to take a deep breath while I hook at the liver area. Alright, I want you to take a deep breath. Then relax. Alright, so no tenderness is found. That might indicate hepatitis and other liver diseases. Alright, so to test for cholecystitis or inflammation of the gallbladder, we'll be palpating for your costal margin, and I want you to take a deep breath. Let me know if you feel any pain, alright? Okay, inhale. You can relax now. Alright, so there are no pain and tenderness is found. Alright, so this time I'll be palpating for your spleen, so I'll be assisting you to a side lying position. You have to face towards me, and I'll be palpating for your spleen. There are two methods, and I'll be using the second method. So I'll be palpating for the spleen by moving it downward and forward. Let me know if you feel any pain, right? Okay, so spleen is non-palpable. You're not feeling any pain, alright? Alright, so no pain as well. And tenderness is found that might indicate enlargement of the spleen. Okay, so you can, I'll assist you to a supine position now. Alright, so this time I'll be palpating for your kidneys, and I'll be placing my left hand at the back to provide support and my right hand at the costal margin. Then I want you to inhale, then exhale. I'll be gradually removing my fingers. Alright. So I'll be doing the same thing on the other side as well. So I'll be providing support using my right hand. And then I want you to take a deep breath. Inhale. And exhale. Let me know if you feel any pain, alright? Okay, so did you feel any pain at all? Alright, so no pain is felt. Kidneys are non-palpable and no indications of enlargement and no tenderness found. Alright, so for hypersensitivity test, I'll be using a broken cotton tip as a sharp object to stroke your abdomen. I'll grasp a fold of your skin while I do this, alright? So let me know if you feel any pain, okay? I'll be doing this several times at the right lower quadrant of your abdomen. Okay, so did you feel any pain? Alright, so no pain or no exaggerated sensations are felt that may indicate appendicitis. Alright, so for the next part, we'll be assessing for the Psoas sign. So to assess for Psoas sign, let me assist you to a side lying position. Alright. I'll be extending your leg. Okay, so let me know if you feel any pain, alright? Do you feel any pain?
No.
Alright, so there is no pain present that may indicate irritation of the iliopsoas muscle or inflamed appendix. Okay, so let me assist you to a supine position to assess for obturator sign. Okay, draping one leg. Okay, so this time I'll be flexing your hip and knee as well as rotating your leg internally and externally. So let me know if you feel any pain, right? Do you feel any pain?
No.
Alright, so no pain is present that may indicate irritation of the obturator muscle or perforated appendix. Okay, so I'll be draping you now. Okay, so Miss Red, we're almost done. We're at the last part of the assessment already. So to test for appendicitis, I'll be assessing for rebound tenderness by palpating on your appendix at the 90-degree angle. Okay, so I'll be releasing it now. Okay, so Miss Red, may I ask you, which hurt more, when I press it or when I release the fingers?
I didn't really feel any pain at all.
Okay, so no abdominal pain and no rebound tenderness is found in your appendix. Alright, so Miss Red, we're almost done with your assessment. Just make yourself comfortable in your bed, alright? So I'll be summarizing the findings earlier. So upon inspecting your abdomen, there are no presence of dilated veins or observed, no stretch marks, no lesions or any rashes, and there are no scars observed as well. So also your skin tone seems to look normal and your abdominal movements are symmetric. Upon auscultating your abdomen, I also observed series of intermittent soft clicks and gurgles. which is normal. There are no bruits or low-pitched murmurs like sounds are heard upon auscultation of your abdominal aorta, your renal, your iliac, and your femoral arteries, which is a good thing. Also, there are no venous hum and no friction rub over the liver or spleen was observed, which is considered to be normal. And also, upon percussing your abdomen, I observed that your vertical liver span is at 10 centimeter, which is within the normal range. Furthermore, lower border of the liver dullness descends from 6 centimeters below your costal margin, which is also within the normal. Also, upon percussing your spleen, I observed that the area of dullness of your spleen is about 7 centimeters wide near your left 10th rib, slightly posterior to the mid-axillary line. And I also observed that your lowest interspace in the left anterior axillary line has a tympanic tone, which means that there is no signs of enlarged spleen. So, no tenderness or pain is observed upon blunt percussion of your kidney and your liver. Also, upon performing the fluid wave test earlier, no fluid wave is observed, which is a good thing. So for the palpation of your abdomen, I observed that the abdomen is non-tender and soft, and no guarding was observed as well. So no palpable masses are present. Desiccation, size, and shape seems to be normal, and no tenderness was observed. You also have no signs of swellings, masses, bulges in the umbilical and the surrounding area. The aorta is about 3 centimeters wide with a regular and moderately strong pulse, which is also normal. The liver seems to be firm, smooth, and even consistent, which is a good thing. No signs of cholecystitis. The spleen, kidney, and urinary bladder seems to be normal. No pain or exaggerated sensation was observed. And also at the last part of our palpation earlier, you are also negative for Psoas sign and Obturator sign, and also no presence of rebound and tenderness in your appendix. Alright, so all in all, I observe a normal finding in all the procedures that I have performed during the assessment. So as what you have mentioned earlier, stress and anxiety can also be a factor in the loss of your appetite, and so I can demonstrate some stress management behaviors. You can also do different activities that can lessen your stress, such as listening to calming music or doing deep breathing exercises. All of these data gathered will be transferred to your physician. So we will just contact you for further examination. So do you have any questions or clarification, Ms. Red? Alright, so Ms. Red, you have been a wonderful patient, and thank you for being cooperative. Alright, I'll see you next time. Okay?
Thank you.